I now recognize Mr. Softar for his opening statement. And I apologize for mispronouncing that. Maybe you can correct my...
It's fine. Chairman Comer, Ranking Member Subramaniam, distinguished members of the House Oversight and Government Reform Committee, thank you for your leadership on this issue and for inviting me today. My name is Shabir Imber Safdar. I am the Executive Director of the Partnership for Safe Medicines, a coalition of all members of the supply chain dedicated to protecting Americans from counterfeit medicines. I would like to, you've read my written testimony and it's long and I apologize for that, but it's very thorough. We've been doing this for over 20 years. But I want to just focus my comments on just 3 areas today which I think are of great concern, and they focus on the current crop of crime and patient endangerment around GLP-1s, or weight loss injectables. First, unlicensed vendors are selling unregulated GLP-1s to patients without prescriptions. We see these sold on e-commerce websites like Etsy, through med spas, which are unlicensed to often distribute prescription drugs, and also through fake online pharmacies selling them as peptides. They're often labeled as research chemicals like this one and not for human consumption, and yet people are being sold them with instructions to inject them anyway, and they often do. We're not the only group worried about this. In February, 38 states' attorneys general wrote to the FDA asking them to take action on these, and the FBI issued a similar alert, also raising concerns about compounders using illegal ingredients in their products and illegal compounding. Second, the FDA has cited patient safety issues even with legally compounded weight loss injectables. Now, compounded medicine fills a critical need in our drug supply and makes our drug supply more resilient. For example, consider a medicine that commercially comes in only an oral dosage form, like a pill, and the patient has swallowing issues, perhaps because they're a child or because their swallowing abilities are compromised. In that case, a compounding pharmacy can make a liquid form and allow that patient to take the treatment. That compounded treatment, while an unapproved drug by the FDA, is still better than skipping the treatment altogether. However, the FDA has been clear that these are not FDA approved and pose safety risks because they are not clinically tested for safety or efficacy. But if a patient must choose between taking a needed medicine or skipping treatment, obviously you do take the medicine. But what we're seeing in compounding of GLP-1s is a different situation altogether. Opportunistic telehealth companies are enticing people who don't plan on using weight loss injectables to start therapy on these compounded, unapproved products. And GLP-1s are sterile injectables. And compounding sterile products is very challenging, something we've actually seen from reading inspection reports by state boards of pharmacy and the FDA. On top of that, legitimate and safe ingredients for compounded medications, for these medications, are actually difficult to come by. And in every case I've seen in my experience, when things are difficult to come by, criminals step in to fill the gap. PSM recently studied freight shipments of both semaglutide and tirzepatide, the active ingredients in major weight loss injectables, coming in as freight using the FDA imports database. And most of these were coming in from China and India, in some cases Canada, and we found multiple entrant shipments that should have been denied entry at our ports. By studying that database, we found one shipment of semaglutide that claimed to be manufactured at a JW Marriott in Canada. Now, not surprisingly, we did check the FDA's registered facilities database for facilities in Canada, and that JW Marriott is not, in fact, an approved manufacturing site that's ever been inspected. It was refused by inspectors, which I am grateful for. But the second one was a shipment that was stated to be manufactured at a health club in Toronto, Canada. That shipment did actually make it through, and so it came in, and we don't know where it went. I'm sure the FDA's Office of Criminal Investigation probably does, but it went somewhere in the U.S. and is destined for U.S. patients, either by a legitimate or illegitimate dispenser. A third bucket of GLP-1s that I would like to point out are these look-alike counterfeits. It looks exactly like an injector pen that would come from the branded manufacturer, but it does not, in fact, contain the active ingredient or the right ingredient. Sometimes it even contains needles that have been compromised with bacteria. This is an example of a unit of fake Ozempic that is not, in fact, Ozempic. The criminals actually peeled off the label of the real product and then printed up an Ozempic label and put it on it. A very alert pharmacist in Arkansas spotted this unit and quarantined it so that it would not be given to a patient, and called the investigator at the Board of Pharmacy. The Board of Pharmacy's investigator came over and used a new tool developed by the National Association of Boards of Pharmacy called Pulse. It's a scanner app, it's on your phone, and they used that tool to make literally under a second determination that that product was counterfeit. That quick thinking by that pharmacist and that investigator almost certainly protected patients in Arkansas and around the country, because the Arkansas State Board of Pharmacy then immediately moved to suspend the license of the Florida distributor who was shipping it into Arkansas, so they could no longer do business in Arkansas. I am very proud of the safety of the U.S. prescription drug supply. It's the best in the world, and yet it contends with an enormous, perhaps globally record-breaking amount of criminality. And despite that, none of us have to worry about walking into a bricks-and-mortar pharmacy and getting a safe medicine. That is something that both keeps me up at night and actually also makes me very comfortable about living in the United States. I thank you for your time, and I look forward to your questions.